Live from Chattanooga, Tennessee, it's Nooganomics with David Tulis.
Ari's is a great restaurant along the glittering waters of Lake Chickamauga in Soddy Daisy. Ari's Harbor Lights restaurant, and it has a special treat, a dinner for you and your beloved on this new year. Or any other day except Monday, $19.95. You get 10 entrees. There's a happy hour 3 to 7 p.m. And the number, if you want to call to find out more, is 843-2800, 843-2800. Ari's Harbor Lights restaurant, a delight and classy restaurant for you right here in the Hickson area. And I do encourage you to go in there and try Ari's if you haven't. By the lake. Also, if you want to increase your spirits, make sure you go to One Stop Package in Soddy Daisy. There's 10% off if you buy wine by the case. That's 10% at One Stop Package in South Soddy Daisy, right near the Thrasher intersection there. There's wine, beer, liquor, best prices, and there's a huge selection at One Stop Package in the Sunshine Market. It's brand new liquor store in Soddy Daisy. And my name is David Tulis. I do thank you for giving us a couple of minutes of your time. Our argument is love your neighbor and buy local. And finding local economy in the details, and finding local economy not just in eating out, such as at Ari's or Wimpy's in Soddy Daisy, but also in your arrangements for medical care. Do you have a facto doctor on that visit? Well, there are local economy alternatives, and one of them is provided right near where we are here in Hickson. We are AM 1240 Hot News Talk Radio with a Soddy Daisy Tower and a studio here in Hickson in the Goss Insurance Building. And not too far from us is Hitchcock Family Medicine, which is right next to the Raphaels on Hickson Pike, and the proprietor and the physician in charge is Matthew Hitchcock, a former Navy physician. He's a dad. He's got 3 children, ages 1, 3, and 6, with his wife Kathleen, who is the nurse. She is the one to make things happen for Matthew Hitchcock. And the model for local economy in medical care is one I want you to get your mind around. I think it's going to be a little difficult if you haven't thought about the alternatives to insurance and government insurance, but it is there. It is the free market in medical services for you, my listener. Well, Matthew, what is direct care? What is retainer medicine all about? How does it work, and how does my listener need to start thinking about it as a possible remedy for his medical needs, especially in this business?
So direct care, we call it that because it's a direct financial relationship. There is no third-party insurance middleman between the physician and the patient. That really gets back to the spirit of the doctor-patient relationship in that. There are other terms for it out there. Concierge medicine is one that kind of comes up sometimes. Retainer medicine, because it's almost like having a physician on retainer for it. It's
what would retainer, how does that word apply in other professions?
So just like you have an attorney on retainer, you pay that attorney a little bit every month to kind of have access to them when you need it. Same thing, you pay me just a little bit every month to have access to me when you need it. It's a pretty different concept. A lot of people now have the idea of, you know what, I'm going to pay that fee-for-service model that we have right now. I pay a fee every time I go in and see the physician, or I have insurance, so my insurance should pay a fee every time I go in and see the physician. This is a little bit different. We're being a little bit more proactive with folks' healthcare with that. You're paying that monthly fee. It's a flat monthly fee every month, whether you see me or not, just like a gym membership. But if you come in and see me every single day of the month, it's just that same flat monthly fee. And for that, I think take better care of folks than just that 15-minute kind of cattle call insurance-based office visit for now.
And why, briefly, is my listener facing these cattle call doctor visits? What is the pressure on that practice, on that physician and the office administrator to make it that he has to get in and out, and often not seeing the doctor and spending most of the time possibly with a physician's assistant?
For that now, with practices that take insurance, there's a huge administrative burden on that. There's billers, there's coders, there's all of these people behind the scenes that do it. And every year, insurance is paying less and less for that same visit. So just like any other economy, the only answer, if I'm getting paid less per individual widget, I just have to do more per day. So it's a race to see how many patients I can see in a day so that I can still actually be profitable and make money. That's the kind of the norm for the insurance world. You spend more time now with either the MAs checking you in or that, and everyone's more concerned with the computer in front of them. And you mentioned kind of PAs and nurse practitioners in there. That's a little bit different too, because insurance actually pays them less for the exact same visit, so they can actually be a little bit more profitable for some of the groups and stuff with that, when you get a nurse practitioner or a PA kind of involved in the care for it.
Well, you have a goal of how many families in your practice. What is the maximum number of people that you and your wife Kathleen, your nurse, can handle as a practice?
So for this, we've set a cap of about 500 people. Just that's small enough that we can know every single one of my patients. They're not just a number on a chart, and I'm having to read every time to remember who they are. But it's large enough that we can make a little bit of money off of it, but still offer great care and same day appointments, hour-long appointments, house calls if needed. Things. For this, it's easy. It's a flat monthly fee based on their age. So if they're 18 to 44, it's $55 a month. If they happen to be the 45 to 64 range, it's $75 a month. And 65 and up, it's $100 a month. Basically, it's kind of staggered that way because if you think about it, typically the younger folks are less likely to come in and see the physician. So don't want them subsidizing care for everyone else.
Okay, so the middle range is 18 to 65, and how much is that?
So the middle range, it's 18 to 44, and that's the 55. The 45 to 64 is $75 a month, and then if you're older than 65, then it's $100 a month, and children are $10 each.
So, you've just started your practice. When did it begin?
Just over a month ago. So around the 1st of November is when we officially opened, and started enrolling folks in this. And it's been a very rewarding experience. I actually feel like I'm practicing medicine again.
Well, my listener he understands kind of in theory what you're saying and how your business model operates, Matthew Hitchcock of Hitchcock Family Medicine. But he doesn't see how it applies to him. He just can't see his way to ever using someone like you. You are, in his mind, a kind of interesting economic novelty, something that David Tulis pushes, but he doesn't really understand it. Why does my listener not understand what you're offering, what you're really saying? What is his situation with his insurance company, for example, that makes it difficult to perceive you?
Well, it's a paradigm shift for folks. They have been so ingrained that I need insurance to go in and see the physician, and that my insurance company will pay for it, or at the end of the year, if they haven't met their deductible, your list out of the exam room. And a lot, as odd as it sounds, paying me that monthly fee actually winds up saving them money, every year for it.
Even if my listener is paying $600 by deduction from his payroll, or $900 per month to have insurance.
Correct.
Explain how that. I don't get that.
You don't quite get that. So for most folks, they have that huge deductible. I mean, that's just the standard now. Very few people have an insurance plan without a sky-high deductible for it. And every time they go in to see the physician, that's coming out of their pocket. That the $200 for their cold, their different visits for that is coming out of their pocket. And that really keeps them away from the doctor. Like, well, I haven't met my deductible yet. I'm just going to tough this out and not go to the doctor. For this, for basically a known monthly fee, they have unlimited access to their physician. You have something go wrong, you can call the doctor. You have my cell phone 24/7. They can come in and see me. The biggest thing I think that saves folks money on this with their deductible is in the what I call the incidentals, the ancillary services. So medications, labs, and radiology studies. Typically for those things, they bill your insurance. There's that whole extra layer of bureaucracy on there that kind of eats away at their overhead for those companies as well. I went to them and said, hey, if you bill me and offer you cash up front, how cheap can I get these tests? And for a lot of the lab tests, I actually get it at their cost of testing. So their cost for the supplies to do the test. For instance, a complete blood count is $4.32 at my office through Quest, which is normally in the $40 to $60 range if you go through insurance at your regular doctor's office. Thyroid test is $7. It's about $90 if you go through the regular your regular doctor's office. I had a young lady come in, had some issues going on, hasn't been to the doctor to discuss them because she hadn't met her deductible. She knew it was all going to come out of her pocket, and she didn't really want to go. She signed up with me, came in. We figured out that she actually had a thyroid problem by ordering that test. I ordered a couple of lab tests. It cost her, I think, $17 total for all of the labs that I ordered. We found out what was going on with her, got her the meds for less than $1 a month for some of the meds that she needed. And she has the money that she saved right there probably paid for her monthly fee for almost the whole year.
Well, there's a second part to my listener's hang up, and it's this. He's saying, okay, I understand that if I pay separately out of my own pocket to be a member of Hitchcock Family Medicine as a subscriber, as a in my plan, I'm still with my employer. There's no window to get out from my employer in that relationship with the insurance. So coming to you doesn't add to the amount that I can stack up. Hopefully, adding those charges up to meet my deductible and then pass my deductible so that I can have some reimbursement from insurance. Talk about that problem.
So all of those things that I mentioned, the things outside of my monthly fee, can be applied towards your deductible to hopefully you won't with that.
But doesn't that require you to be in plan somehow?
No. You can apply it towards your deductible as an out-of-network provider, which is what the insurance companies like to call me because I'm not part of their machine operating for that. I'm an out-of-network provider for all of them. They can take that invoice from me, submit it to them, and have it apply towards your deductible. But like I said, with her, it was $17 worth of labs that if we had billed her insurance, it would have been over $300 for those labs, which all would have came out of her pocket for that.
What changes in the national economy? Matthew Hitchcock, a physician here in Hickson. This is David Tulis. We're talking with the man who runs Hitchcock Family Medicine, new in Hickson, and he is working in a new free market paradigm, a local economy paradigm for medical care, and that's called direct care. It's also called retainer medicine, where you retain Matthew as you might retain an attorney, paying that attorney $100 a month or so to have quick and easy access to his services. What are some things coming in the national economy that will bring pressure upon my listener to turn to you as a
Well, I think a lot is with insurance now. With the Affordable Care Act, insurance can't turn away people, hence the individual mandate trying to get young, healthy people to sign up to kind of prop the system up. And every year, I talk to people every day that just say, oh, man, this year my deductible, it's going up. My monthly premiums are going up. Just all of this stuff is going up for them. And I offer kind of an out for that. I tell people they still need insurance. Absolutely. You need insurance for the big things. I mean, if you look back to what insurance, how it started, I'm transferring risk. I'm paying someone to assume the risk of something financially catastrophic and unforeseen happening. And when we try to use our insurance for things that I see coming and I can financially handle, it blows the whole system apart. I mean, you wouldn't use your car insurance to pay for your gas in your car. I mean, people would say that was
putting
absurd.
air in the tires,
or putting air in the tire, or
changing a light bulb.
Filter. I mean, it would be ridiculous. People would look at you funny if you said that, because they understand that if I started doing all of those things toward my car insurance, it would become astronomically expensive. But we do that every day in our health insurance and don't bat an eye because we kind of look at it that way.
So in a way, my listener and I share a kind of fantasy, a kind of unreal economic view of the world, which says you can have constantly drawing on a system for which other people are paying for, the third party, that would be government or insurance companies. And we can have this care. So the consumer, the man or the woman who uses the medical services, is not really allowed to be price conscious, and so we have this ballooning apparatus behind that service.
Yeah, correct. And when you have a don't know how much. I have no idea, you know, because it's all hidden behind kind of bureaucracy and all of that. Nobody really knows how much it costs. Versus this, you know, I'm trying to say upfront, you know what, this is how much it costs. This is what we're going to do.
If you took insurance, Matthew Hitchcock, you couldn't have just one coworker or one employee in your business, Kathleen, your wife. You'd have to have maybe one or two people who handle the coding. Talk a bit about the coding burden upon the medical business and how many you would have to have if you got your goal, which is 500 families.
Oh, absolutely. If I took insurance, I would have to have all kinds of people behind me to kind of support that. I'd have to have billers, coders. I couldn't get away with just me doing everything in a patient an hour. I have to see several patients every hour to kind of get up with that. So I would need medical assistants to help me kind of get people through the process. It turns into it for that. But the coding burden on physicians now, I don't know the last time you went to the doctor, but half the time, most of the people at the doctor's office seem more intent on the computer sitting in front of them than you are. And that's because they're trying to check all the little check boxes to make sure that they get paid. Has nothing to do with your medical care or anything like that. It's just at the end of the day, am I going to get reimbursed from the insurance company for the correct diagnosis? If I put the right code in, I'll get a little bit more.
So it's almost as if, Matthew Hitchcock, as if my listener is not the patient, not the customer. The customer really is the party who has to be satisfied, and that's the insurance company and those people back on the other side of that relationship who get reports filed digitally by the medical office, coding conditions and treatments and affirming that they're according to the spec. But even there are problems because sometimes the diagnoses and the judgments against your judgment on what's needed are contradictory, right? And who suffers then when they say, well, that's not a right judgment?
Well, it's your listeners, the patient. They're the ones who suffers for that because the third-party insurance company gets to stand in and say, hey, you know what? This code that they put on the box when they checked it doesn't quite match what all they ordered, so we're not going to pay for it for that. And it's utterly ridiculous that it's somebody with a high school diploma sitting in an office somewhere gets to decide what medical care you actually get. And it's not somebody with a doctorate or anything like that.
So my listener, I think, Matthew Hitchcock, needs to view what you're offering is maybe new. You're shifting the paradigm a little bit. My listener and I, we have the preconception that insurance means medical care, and that's not true. The listener has a duty to his wife and his children, and how is my listener to view his duty to care for his family apart from the insurance relationships that he has? Is it possible to do that? How, in other words, I'm asking you, what are the arguments that you would make to him to consider the direct care model as a way of really fulfilling his duty as a dad and as a husband?
Insurance coverage does not necessarily mean health care on that. That's two very different things. So just because somebody has insurance, that doesn't mean that they can get in to see the physician, that they can get in to see the clinic and get the medical care that they need when they need it. For instance, I see so many people that come to me and say, hey, you know what, I was sick. I called my doctor's office and they said, well, I'm sorry you're sick, but our next open appointment's in 4 days. And that's just drives them to the urgent cares or to the ERs and kind of overloads those systems. And I think the expansion of all the urgent cares around town are kind of a sign that the primary care in this community and the country in general is kind of suffering, for that.
You're not alone in this endeavor in the local economy, are you, Matthew?
No,
who are some of the other doctors who share?
Several other docs around here. I know Dr. Red over at Quick Search has become a great friend of mine as we've kind of started these two practices together, and both of us kind of stepping outside of the insurance world and saying, hey, you know what? There's a better way to do this, to take care of your health care, to not have someone else kind of stepping in and saying what you can get and when you can get it, that you can do this on your own outside of that. And that's been great. There's several other different ones kind of around the community here doing this. Absolutely no interest. One, they're doing what's known as a hybrid model, where you pay kind of a smaller monthly fee, but then they still bill your insurance every time that you come in, and for that. But I'm the first one that absolutely stepped outside and said no insurance at all.
I know there's a pain management clinic, I think in Ringgold, that's making this step. There's Dr. Charles Adams, who's a man of kind of alternative view of medicines. He's planning to move from, I think, North Georgia to East Ridge. There's Homero Rivas, who's he's not a chiropractor. He's a medicalist. I'm not sure what the name is now, but he's something somewhat akin to chiropractic. He's got a clinic in the building right next to the Highway 153 Target complex. He's has his office there. So there are about 5 or 6 right there. And there probably will be a growing number of others as well.
I think you're going to see a whole lot more. I think physicians, just as unhappy as the patients are with the whole system of feeling like they're just a number on a chart and not having time for it, the doctors feel that same way too. They're just as frustrated with the whole system.
There are some specials for you at Don Ledford General Motors in Cleveland. The Cleveland, Tennessee car dealership has year-end specials for you, my man listener, my guy listener here at the testosteronal radio station. And you can save a whopping $10,000, up to a whopping $10,000 through the 4th of January in big pickup trucks and manly vehicles. And a little icing on the cake is a $1,000 gift card. That's at Don Ledford General Motors, Don Ledford in Cleveland. Go today and check out his huge lot in the north side of Cleveland. That's Don Ledford General Motors. My name is David Tulis. Matthew Hitchcock, thanks for joining us.
Absolutely. Thank you for having me.